All right, welcome back to ABA exam review and our latest set of RBT exam practice questions where we're going through this set together and breaking each question down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Sandra's mom is frustrated with Sandra's defiance. She decides she's going to start putting Sandra in timeout in an attempt to punish Sandra for defiance. Timeout will involve Sandra sitting by herself on the couch with no toys for 30 minutes. What can we conclude about timeout in this scenario? As a technician and as a practitioner of behavior analysis, we need to start thinking about consequences differently. We're thinking about consequences in terms of reinforcement and punishment, but ultimately we're deciding if something's reinforcing and if something's punishing based on how it affects future behavior. So in this case, if the question doesn't actually say how future behavior is affected, it's very difficult to determine if it was actually punishing or if it was reinforcing. So in this case, we're looking at timeout, and what can we conclude about timeout? Because Sandra's mom is frustrated with defiance. So she says, I'm going to put Sandra in timeout in an attempt to punish Sandra for defiance. And since timeout is typically a punishment procedure, and it says explicitly she wants to punish Sandra, well, attempt to punish Sandra, then we know for a fact at least that Sandra's mom wants to try and decrease defiance. But it never says if it actually is effective. All we know is what the procedure looks like. Sits by herself, on the couch, no toys, 30 minutes. So what can we conclude about timeout in this scenario based on our information? Remember, you're only using the information given. A, it is unethical and should not be used. Just not true. Timeout is a pretty standard practice. Of course, we always try other means first as behavior practitioners. However, timeout can be used, and it is frequently used. B, it will reduce defiance. Well, we don't know that for sure. We're not sure how timeout is going to affect Sandra quite yet. So it remains to be seen how is it going to affect Sandra's behavior. C, it will cause the mom to become an aversive. Potentially, when punishment becomes part of the intervention, then whoever's administering the punishment, there's always a risk that they become the aversive. But this word will is very strong. It's saying it's definitely going to happen, and we can't know that for sure. And then D, timeout will involve Sandra sitting on the couch by herself with no toys for 30 minutes. That's all we can conclude. This is all we know based on the information. We don't know how it's going to affect her behavior. We don't know how it's going to affect the mom. It's not unethical, so all we know for sure is what it looks like. Sitting on the couch by herself, no toys, 30 minutes. Alexander fidgets and moves constantly while sitting and standing. When Alexander is engaged in conversation with others, he always tries to hold something in his hand, like a pen. Usually, this reduces the amount of fidgeting and moving Alexander engages in around others. What is the function of Alexander's behavior of holding something in his hand? So we're looking at a function question, and we're thinking in terms of our four functions, right? Functions, why the behavior happens, its effect on the environment, and we think of four functions as attention, tangible, escape, and automatic. So why is Alexander's behavior happening? Why is he holding something in his hand? Well, we know he fidgets and moves constantly, and so when he holds something in his hand, right, it reduces the amount of fidgeting and moving. So therefore, it's taking away the fidgeting and moving, which therefore is negatively reinforcing Alexander. He's continuing to hold things in his hand. So what would you consider the function based on that information of holding something in his hand? A, attention. Is Alexander gaining attention, or does he seek attention through this? Well, no, Alexander is doing this all himself, right? There's not another person in the question administering this reinforcement or administering this consequence. It's all within Alexander. So he's not trying to gain a tangible either. There's clearly no want or desire for Alexander to gain a tangible. He's not necessarily escaping, right? Now, you have to be careful here, right? Because we could say, well, he's escaping the fidgeting and moving. And you could argue that could be the answer. But what's the most clear answer? What's the best answer here? What's the most obvious answer? Well, the most obvious answer is automatic, right? Alexander is automatically reinforcing himself because there's nobody else administering the consequence. Now, if you wanted to argue, well, he's escaping from the fidgeting and moving, you could probably make that case. We'd have to do a little more analysis, most likely, right? Need a little more information. And so what we know for sure is the function is automatic because Alexander is by himself. He's doing this alone. He's administering his own consequence. So kind of a tricky question because you could definitely argue for escape, but based on the information given, the best answer is going to be D, automatic. Kurt is very soft-spoken and shy. He struggles integrating into social situations with his peers. One of his goals is to initiate interaction with peers during the school day. Your supervising analyst explains that it's important to get Kurt to speak louder so his peers hear him. What is the analyst primarily focusing on relative to Kurt speaking? Question is asking about what? It's asking about the analyst's focus on Kurt speaking. What do we know about Kurt speaking? Well, he's soft-spoken, he's shy, so he speaks quietly. He struggles in social situations, but the goal is to initiate interaction. And so in order to do that, the supervising analyst says, I need Kurt to speak louder. And this is the key, speaking louder. And so when we talk about force and intensity, things like loud, soft, hard, quiet, those type of force and intensity words, what are we referring to relative to behavior? A, function. Well, function, of course, is why the behavior occurs and the effects on the environment. The analyst is primarily focused on speaking louder, right? Relative to what we know, he wants Kurt to speak louder. Okay, so that's not necessarily the function. What it is the magnitude. With the magnitude, we're looking at the force, the intensity. Loud, soft, hard, these type of things, where we're describing how intense something is. What is the force of something? We need Kurt to increase his intensity. He needs to speak louder. It's different from topography. Topography describes the form and what it looks like when Kurt is speaking. When we talk about magnitude, we're talking about the force with which Kurt speaks. So the analyst is focused on the loudness. So the analyst is focused on the magnitude of Kurt speaking. Understand the difference between topography, which is the form and how it looks, and the magnitude, which is the force or the intensity. When is it acceptable for a parent who is also a behavior technician to work with their own child and implement behavior interventions? So I threw this in here because recently the BCBA sent out a newsletter clarifying the role of parents who are also behavior technicians. And it can get a little tricky, right? Because as parents, you need to be involved in parent training. However, we can't engage in multiple relationships even with our own children. And there's no more of a personal relationship than a parent and a child. So this question is asking, when is it acceptable for a parent who's also a technician, so they abide by the BCBA code, to work with their own child and implement behavior interventions? When is that okay? A, parents are always allowed to work as the behavior technician for their child. Well, they're just not, right? Because now we're crossing into a professional landscape. We already have this personal parent-child relationship. If we have a professional relationship as well, that's going to be a multiple relationship. It's not allowed. B, parents are never allowed to implement behavior interventions for their own child if the parent is also a behavior technician. Well, B is too strong because parents still do need to engage in parent training, and they still do need to work with their child. They just have to do it on their own time in a personal relationship. C, parents who are also behavior technicians are allowed to implement interventions as part of a comprehensive plan that includes parent training. Yes, this is what we're looking for, right? We have parents who are BTs. They're allowed to implement interventions as part of a plan that includes parent training. So they're not the lead technician. They're not the actual technician. They're still the parent. They're still working as the parent, but they're engaged in this plan of comprehensive parent training, meaning they can't be on the case. They can't go and bill hours working with their child, but they do need to still engage in parent training. So when is it acceptable? Well, as part of a package, as part of this parent training plan. You, a behavior technician, just learned that your daughter has autism. Since you are already a behavior technician, you request that you work as the lead technician for your daughter once her ABA services begin. Is this allowed? All right, very similar question, right? We have a behavior technician, which is you, and their daughter has autism. So we've already got that personal relationship, very personal. But you are a tech and you want to work as the lead tech on her services. Is this allowed? Well, we just talked about it. It's not. You can't actually work in that professional capacity. Again, when ABA services begin, as the parent, you will be involved in parent training and implementing things at home. You just can't work professionally with your own daughter. So A, yes, but you will need to stop working with any other clients you may currently work with. Well, of course not, right? One, you can't abandon your clients like that. That's definitely not ethical. And two, you can't work with your own child in a professional ABA-related aspect. B, yes, but only if you receive permission from the certification board. Well, they just clearly laid out what they find acceptable and what they don't find acceptable. And they don't find this acceptable. So C, no, you're not allowed to work as a technician for your own child in a professional capacity. That's what it comes down to. We can't have multiple relationships. We can't work with our own children in a professional capacity because now we've entered into a multiple relationship, which we know is not allowed. Your client enjoys playing with the farm animal set they received for Christmas. The client will grab the toy cow and say, moo moo. One day, you're flipping through a picture book with the client, and the client spots a cow in one of the pictures. The client says, moo moo. What type of verbal operant is this? Now, verbal operants are more behavior analytic in nature, right? Meaning BCBAs and BCABAs need to know these very well. RBTs, you really don't have to know them in depth. I like to ask questions occasionally, though, just to get you familiar with the language in case you see it. Because in practice, you will be using all this language quite a bit. You're going to be talking about tax and echoics and interverbals and mans all the time. So you have to kind of at least know a little bit about what these things are. And so in this case, what is the client doing? Well, he grabs a cow and says, moo moo. So he's labeling the cow, right? Moo moo. The client then spots a cow in a picture book and says, moo moo. So what has the client done? Well, he's labeled the cow, and the label is simply a tagged. An echoic is when somebody copies something that was said. So when you have clients who may repeat phrases and words and things they hear, that's an echoic. The client's not doing that. He's just labeling what he sees. An interverbal is when a learner responds, right, in almost a conversational way. Again, not doing that, client is simply labeling. And then as an RBT, you don't really need to be worried about the textual too much, which is essentially more or less reading. So what the client's done is tagged or labeled this cow. So as an RBT, again, you don't necessarily need to know this stuff in depth. You just need to be familiar with that these exist, right? You need to know they exist. Tags, labels, echoics are imitation or copying. Interverbals are responding or conversation. And mans a request. Simple as that. Just understand those basics and you'll be fine. If you wanted to maximize a generalization procedure, what type of reinforcement or reinforcement schedule will be best for you to use during the intervention? All right, we want to maximize generalization, which is arguably the most important part of treatment. What type of reinforcement are we looking to use, or what type of reinforcement schedule are we looking to use? A, continuous. Well, with continuous, when are we reinforcing? We're reinforcing every time the learner engages in the behavior. And that's not going to help generalization, because in generalization, we're looking for the client to start engaging in behaviors in unlearned and untrained and novel environments. And we know in the natural, untrained, novel environments, reinforcement is not continuous, right? We engage in behaviors all the time that really don't receive immediate continuous reinforcement. So continuous is not good at all for generalization. You have B and C, two fixed schedules. Well, the fixed schedules, they're unchanging. Again, with fixed schedules, they can be predictable and they can be planned for by the learner. With generalization, we're trying to model what the real natural environment's going to look like. And a fixed amount of reinforcement is just not realistic. Neither is continuous. So what you're looking for really is this naturalistic reinforcement. How can we get reinforcement to our client that is produced from the natural environment? That's really the key, right? how can we mimic or mirror what the natural environment is producing? How can we get our client to produce reinforcement from the natural environment? That's really what we're looking for in generalization. Tony wants to decrease the amount of gum he chews per day. If he chews one piece at a time, what would be best for Tony to decrease in order to accomplish his goal relative to gum chewing? All right, we have Tony who wants to decrease what? He wants to decrease the amount of gum he chews per day. He chews one piece at a time. Now, when you see this word per, what are you thinking of? I mean, you should be thinking of frequency. Frequency is you should be thinking of rate. Rate is frequency per time. So when you see the word per, think rate off the bat, frequency per time. And so immediately, if I'm saying, well, what does Tony need to decrease? Well, he's got to decrease whatever measurement's going to reduce the amount of gum he chews per day. So if you look at inter-response time is time in between responses. That would be time in between pieces of gum. If he decreases that, he's going to end up chewing more gum. Because if he goes an hour between gum currently, if he reduces that to 30 minutes, he's now chewing twice as much gum. Not great. What about B, latency? With latency, that's the time between the SD and the first response. Decreasing that is not going to decrease the amount of gum overall he chews, so it's not really going to be effective. Now, what about frequency? Well, sure, if Tony decreases frequency of gum he chews, that's a good thing. But specifically, we're looking per day. And so if we're saying, well, let's just decrease the frequency, well, is that frequency in a year? Frequency in a week? We want to be more specific. So that's why we want to use rate, because rate is going to include that time component. Not only are we decreasing frequency, but now we're going to decrease frequency per day with that time component added. Excellent. Thanks for watching. Check out btexamreview.com for all of our study materials. Let us know when you pass. Work hard, study hard. See you soon.